Within 4 hours of your injury, you should be referred to the Spinal Cord Injury Centre, where staff are available 24/7 or around the clock to give advice to the acute hospital which is looking after you. A member of our outreach team will visit you and explain the process, as well as supporting your current hospital team to start your rehabilitation.
You'll be added to our waiting list and admitted as soon as possible, but sometimes this can take time.
Each week, we meet to discuss the waiting list and admission and provide you with an update before you are transferred to the Spinal Cord Injury Centre.
Once you are admitted, you'll be fully assessed by our specialist team, including doctors and paediatricians, physiotherapists and occupational therapists, speech and language therapists and orthotists.
This thorough assessment is important so we can plan your treatment and may take a few days to complete. After your assessments are complete, you will have a pre-planned meeting with your consultant to discuss your injury, expectations and rehabilitation programme. A case manager will be allocated to you to assist the rehabilitation process and help coordinate your care and liaise with external agencies. Every 2 weeks, you'll meet the team to ensure your priorities are being met as you progress. Your length of stay and intensity of therapy will also be discussed with you.
A large part of your rehabilitation will be learning about your spinal cord injury and how to live with it.
Our dedicated therapy team will work closely with you to preserve and improve your physical function and utilise compensatory strategies and equipment to allow for better independence. Ward-based activities would include ASIA assessment and MMT assessments, and functional tasks, respiratory intervention and bed transfer, as well as gym-based activities such as passive range of movement and splinting, hoisting into a wheelchair and sit to stand, upper limb weighing with FES bike, self-feeding with customised cutlery, tilt tabling and standing frame, plinth work and transfer, as well as wheelchair skills. We also offer activities such as swimming, various sporting sessions, and the use of the gym.
A psychiatrist is an essential part of the spinal cord injuries team. My goal is to help you manage the impact of your injury and find your own way forward. This might be confusing sometimes, and I'm here to support and help you in the way that is best for you.
Social reintegration is an important part of your rehabilitation, and our dedicated staff facilitates trips out of the centre and to your community, including your home when possible. Midway through your time at the centre, you will have a case conference where your progress is reviewed and plans for your discharge are defined. We will also ensure the transition from the centre to your community is as smooth as possible.
You will remain a patient at the centre for as long as you want or need. After discharge, we continue to see children and young people at the Children's Outpatients Department. If required, we will offer you further admissions to address rehabilitation or medical needs.
Once you are discharged, your case manager and one of our community liaison specialist nurses will visit you to review your progress and answer any questions you may have. You will be followed up in our paediatric MDT clinics after discharge at our Children and Young Person Outpatients Department.